I'm not sure if it's just me, but in the past year, a lot of patients have come to me who are experiencing hair loss and hair fall, which can really be distressing. And they're not all the same. So in this video, I'm going to talk about the hair cycle, types of hair fall and hair loss, their possible causes, and what can be done about them. But before I begin, for those of you who are new to my channel, I am Dr. Gaile Robredo-Vitas and I'm a board-certified dermatologist. I try to post one video a week all about the skin and skincare. So if you're into that, please feel free to subscribe. I am also on Instagram and more recently, as in a few days ago, on TikTok as @IreneGaile, and I invite all of you to join me there as well. On the subject of hair fall, it's very important to understand the hair cycle, so I'm going to discuss it briefly. The human hair follicle grows in 3 successive phases. At any given time, your hair is in one of the 3 stages of growth and shedding: the anagen, the catagen, and the telogen phase. The anagen phase is the active phase of the hair. It is when the cells in the root of the hair are dividing rapidly. Next is the catagen phase. It is a transitional stage and about 3% of all hair are in this phase at any time. Regression and follicle degradation occurs. And then finally, we have the telogen or the resting phase, and it usually accounts for about 6 to 10% of all of our hair. During this phase, the hair follicle is completely at rest. At any given time, it is normal to lose a few strands of hair, approximately 50 to 100 every day. Now, hair loss can be gradual, wherein you may notice thinning of your hair on your head, your scalp becoming more visible, pwede din receding hairline, o kaya naman for those with longer hair, a thinner ponytail. Or, it can be sudden and dramatic, such as pulling out several strands of hair when you brush or you comb, seeing bald patches appear within 1 to 2 days, or seeing clumps of hair on the floor of your workspace or on your pillow when you wake up. And hair loss can happen on any body part basta may buhok, not just the scalp. What are the more common types and possible causes of hair loss, and how do we deal with them? First is yung pinaka-common cause that can occur both in males and females, and is what we call as androgenetic alopecia, also known as male or female pattern hair loss. It is largely genetic, meaning na-inherit mo or namamana mo ito, and you have a family member who is balding or has thinning hair. When you have this condition, you will notice gradual thinning and shrinking of your hair until it eventually stops growing. In males, I have seen even those in their early 20s experience this, and it usually manifests initially as receding hairline, followed by hair loss on the crown area. In females naman, it happens later, and usually as an overall thinning of the hair or the scalp becoming more visible. But not to worry, there is something that we dermatologists give that can slow down and stop hair loss, and the outcome is usually successful, especially when started early using the correct treatment. Next, we have telogen effluvium. If you remember the hair cycle I briefly touched on earlier, the telogen phase is when approximately 10% of your hair falls. However, there are certain things that can cause our hair cycle to shift so that most of our hair transitions to the telogen phase and starts to fall. Ano-ano ba tong mga to? One example is stressful life events or anything that shocks or stresses our body. For instance, illnesses, especially those that require hospital admissions, surgery and procedures, and even those that cause emotional and psychological distress, like death of a loved one or getting fired from work. Another example is intake of certain medications. And then finally, nutritional deficiencies like sudden and massive weight loss, crash dieting, or certain micronutrient deficiencies. Hair fall caused by these is not immediate. It takes about 4 to 12 weeks after the stressful event or the start of medication before it starts to show. But when the cause is stopped, our body and hair cycle returns to normal and the shedding stops. In most cases, the hair goes back to normal in 6 to 9 months. In certain treatments like radiation and chemotherapy for cancer, what happens is anagen effluvium, wherein even the hair in the anagen or growing phase falls off. But the hair often grows back after treatment. Third is alopecia areata. This is an autoimmune condition wherein our own immune system attacks the hair follicles, causing hair to fall off, leading to bald patches, which can happen all over the body. The approach to treatment for alopecia areata is to stop your body from attacking your hair follicles and at the same time giving something that helps stimulate the regrowth of hair. The cause may be multifactorial and sometimes idiopathic or with an unknown cause, while others resolve spontaneously. Number 4 is inflammation of the hair follicles from infections, for example, which can be bacterial, fungal, or viral in origin, or from other conditions such as scalp psoriasis. Now, if you have any of these, your dermatologist should be able to properly diagnose and give the appropriate treatment. Number 5 is hair care practices and certain hairstyles. If you are fond of doing treatments on a regular basis like coloring, straightening or perming, or even using harsh chemicals or heat to style your hair, they may cause damage and breakage, which over time can lead to hair loss. Also, wearing a tight ponytail pulled back all the time, cornrows, and even heavy hair extensions can damage follicles and lead to permanent hair loss known as traction alopecia. Number 6, we have hormonal changes such as pregnancy, menopause, or taking oral contraceptive pills. The hormonal imbalance that these cause can lead to thinning or hair loss on the scalp. And a visit to your OBGYN and dermatologist will help. And number 7, last but not the least on my list of common causes of hair loss and hair fall, is trichotillomania, also known as hair pulling disorder. It is a type of impulse control disorder that causes an uncontrollable and irresistible urge to pull out hair from the body, usually as a stress reliever. This later on leaves several patchy bald spots, causing distress that can interfere with daily functioning. So there you have it, 7 possible causes of hair loss and hair fall. There are still others that are not that common, so I've decided not to discuss them here. Now, what then can we do to care for our hair? First, care for your body, as anything you do to it affects you as a whole. Eat a balanced diet, get enough restful sleep, exercise regularly, and manage stress. Second, care for your hair. Use gentle shampoos that don't overly strip your hair off of moisture. Apply conditioner after every shampoo. Ako personally, I just wash my hair every other day. And treat your hair with care. Do not vigorously rub to dry or brush. Third, limit your use of styling tools like blow dryers and curling irons, or use lower settings or protective products if you must. And number 4, protect your hair from UV radiation too. Hair fall and hair loss most of the time is treatable, but it's very important to find out the true cause first. And with so many possibilities, it can definitely be challenging. And this is why getting help from an expert, such as a board-certified dermatologist, who can properly assess and diagnose the cause of hair loss is recommended. So that's it for now. Anyway, I hope I was able to answer your questions, and if you still have more, please feel free to leave a comment, question, or suggestion in the comment section below. And as always, if you like this and if you would like to hear more similar content, please don't hesitate to click the like and subscribe buttons. And I will see you again soon. Thank you guys for watching. Bye!